dress up.
They don't, okay.
It's cool.
Very interesting and really informative.
You could if you wanted to, it's fine. But I don't think anyone really does.
Okay, no, I don't really want to.
But if I'm
Yeah,
wrong,
which I think is brilliant.
They can kick me out.
It's
I
amazing.
don't
Like, why
know.
isn't everybody doing it?
So you wouldn't dress up?
I think there's like
no.
You never dress up?
I would wear like regular clothes, maybe not jeans, nothing serious.
Like I have.
I'm just going to
But it's easier than to like go in and like.
Is that a good thing or
I don't know, I'll let you know tomorrow.
No, I think it's easier.
Yeah.
And like to do that at the city, but I don't know.
And they said, come back with the basic science part, and then basic science part, and then make the so you guys jump. But I mean, is it everyone?
So if you're ready.
Yeah, I'll do that. Great. Great. Well, thanks everyone, and thanks everyone for coming. I know we've got quite a few people who sent their apologies saying they're stuck in traffic on the way down the hill, and they'll still be joining us. As you probably know, there are two key roads coming to Oxford. One's closed because of roadworks, and one's closed because of floods. So we hope they'll get there. So it's an absolute pleasure to introduce Josie Gibson. Josie is the Deputy Editor of Lancet Child Adolescent Health. She has a PhD in biochemistry, which is in cardiovascular science, and has spent over 10 years now at the Lancet, as well as spending time at the Wellcome Trust and other places. And it's really wonderful to have you here, Josie. And Josie, you're going to start by giving us a kind of introduction to the whole area of medical editorial work and publishing in relation to advocacy and policy, and then we'll have lots of time for discussion. Josie.
Thank you very much. Right, whoops, wrong way. Planned the choreography before I started. Yeah, thanks everyone who survived Storm Bird, Storm Connell, and it's also Thanksgiving Day, so those of you who would rather be at home cooking turkey and eating that, you'll have to wait for an hour. Right, so I'm here today thanks to this wonderful invitation from Alan to talk about editorial leadership, advocacy, and public health. And it all started a couple of months ago during a visit where we were sharing our frustration that there's so much evidence out there, there's so much clinical data, yet nobody seems to be listening. So what do we do about it? And I thought, well, coming from the Lancet, we might have a few ideas about how we do that, how we do it well, and what we could do better. So we are a hybrid journal. The Lancet Child Adolescent Health is a hybrid journal, which means that we publish online and we publish in print. 12 issues a year, and we've just published our last issue, the December issue. And in that issue, we published our last editorial of the year, and we called it "The World in 2024 Was Not All Right for Children." And the theme of this editorial was marking 35 years since the drafting of the United Nations Convention on the Rights of the Child. And we reflected on where we've come. We also realized that on a team of 3 editors, we were all among the first children to really benefit from what that convention brought and the rights it gave children to the protection of provision and participation and protection as well. And we asked towards the end of this editorial, well, are we really doing enough to uphold the UNCRC? And if we looked at what we try to do at the journal, which is to publish the most influential and innovative practice-changing original research, as well as authoritative reviews and insightful opinion pieces to promote the health of the whole child from the fetal period to our young adulthood. Yet we see all of these problems come up in the research that is submitted to us, in the news we hear on every day, in the problems that our pediatricians are facing, that our health policymakers are facing. And they're, from newborn mortality to the youth mental health crisis, the problems are being driven by understaffing and under-resourcing in the pediatric workforce, national level and regional level disparities, incomplete data, and complacency. So no, the answer to our question was we do not feel that we are doing enough to uphold the rights of the child to protection, provision, and participation. So although we strive to do this at the journal, I think we ask ourselves again and again, what brings real change that will benefit our children today and in the future? And there are probably as many answers as there are editors, but I'll give you my answer. And I think that answer involves being much more than a repository for research and academic debates. And being from the Lancet, being a journal within the Lancet group, we of course carry the spirit that Thomas Wackley brought when he founded the Lancet, which was to be a radical, he was a radical reformer of the Victorian age, he was a coroner himself. He founded the Lancet to root out corruption and quackery and to challenge the medical establishment. The Lancet was, and still is, registered as a newspaper, and as a journalistic endeavor, we have a duty to hold institutions, people, science, and medicine accountable for their actions. And we, 200 years later, carry that through our day-to-day work. I said we're a group of journals. So the Lancet Child and Adolescent Health was founded in 2017, but you can see that we are now a large family. There are 24 journals now, and we're far more than a collection of medical journals. Not only are we a global team of editors, we're all in-house, we're all full-time, from New York to Shanghai. We work together under the same virtual roof, and together we stand for high quality and reliable medical science. We're vigilant, responsive, and fast. We are annoyed with the health disparities in our world, and we campaign for health equity and the right to health. We are also political. Health is political, and we will hold those in power accountable for their promises. And in our work, and working with the pediatric community, we are advocates and activists for health justice. So that's what we inject into the Lancet Child and Adolescent Health. Now, turning 200, like we did last year, or Lancet did last year, it was a good time for us all to pause and reflect on our priorities. And of 5 key spotlights, one was on child and adolescent health, and it really resonates with the UNCRC, which was that children must be immediately prioritized in health and social policies. Children and young people deserve attention in their own right, and not because they are going to grow up to become an indispensable foundation for a sustainable future. And governments and health providers must prioritize health equity for children and young people within and between countries. So throughout 2023, we thought a lot about this, and we injected this into all of our decisions. So how do we make a difference for children with good research? And of course, we have discovery, opinion, and advocacy. These are the 3 components of the content that comes into the Lancet Child and Adolescent Health. But it's more than just the written word. It's all about campaigning in through organized science. And to us, organized science is assembling science into commissions and series. It is using our special projects such as the Global Burden of Disease, countdown projects, for example, and it's about creating information hubs where we can collect information, whether it's about COVID-19 or whether it's about Mpox. We collaborate with international organizations to have lectures, to have prizes, and also we do a lot of multimedia. So organized science, we communicate this through our multimedia. So we are on social media, we do podcasts, we do infographics and videos, and we do a lot of webinars where we meet scientists and we communicate the story and we communicate the need for change and that advocacy and the recommendations. So I'm going to give you a couple of examples to show how we think we have done really well in this regard. The three examples I'm going to share with you are focusing on the first 1,000 days. So the campaigning, the work that went into campaigning for focusing on the first 1,000 days, about making pain matter, and about prioritizing a neglected disease. And I hope this is going to show you how we can go from evidence to evidence-based recommendations to campaigning for change and making those who have the power to make decisions and to change our society listen. So I'm going to start with the first 1,000 days. This is, of course, the first 1,000 days of a child's life. So this started a few years ago with a series. A series in the Lancet is a collection of review-type articles that gather evidence and that put forward perspective and recommendations. And very often they are designed with a readership in mind that go beyond your traditional pediatric training and will need to have those recommendations delivered in a way that is easy and understandable and can help them prioritize their work. So this early series on advancing early childhood development, it talked about the importance of health, the importance of nutrition, responsive caregiving, security and safety, early learning, and these were the domains of nurturing care. Nurturing care was a concept that was really promoted in this series. This was a three-part series, and you had one paper that looked at early childhood development and the science. The second paper really promoted that concept of nurturing care and explained the importance of it. And then the third paper looked at investing in the foundation of early childhood development, investing in the foundation of sustainable development to scale up that early development. And this wasn't just three papers. This series was supported by a launch in Washington, D.C. by one of our editors, Jocelyn Clark. So she launched this, she spoke with the authors, she spoke to politicians. The authors, Linda Richter from the University of the Witwatersrand and her colleagues, they spoke about it on a podcast. And also there was a huge amount of supporting opinion commentary that was published alongside it. And it was the package that made the difference to communicating this and getting this, breaking through the usual silos for improving pediatric care when it comes to those first 1,000 days. So although this was the series of three papers, a really important part of that package actually came with this viewpoint. And this viewpoint talked about the framing and governance and the challenges that lie in these two elements when it comes to promoting early childhood development. And I'm just going to highlight a couple of key messages from the summary here. It said, the analysis indicates that the early childhood development community faces two primary challenges in advancing global policy priority. The first one is there was a framing challenge, but the second one is even more important to you, I believe, this audience. The second concerns governance, building of effective institutions to achieve collective goals. And to advance global priority for ECD, early childhood development, proponents will need to surmount the framing and governance challenges to leverage these opportunities. And what I think is powerful about this paper is that it is speaking to government. It is speaking to people in power. And indeed, within a couple of years, the House of Commons had produced, House of Commons here in the UK, had produced a report looking at the first 1,000 days of life, putting forward recommendations to the government, which the government then produced a policy paper. So this is my first example of how you can start with a series of papers where you get experts bringing together evidence and putting together some really strong recommendations and translating it and presenting it in a way that makes a bigger difference in using multimedia to really reach beyond the pediatric community to politicians. The second example is about pediatric pain, and I'm so honored that Rebecca Slater is in this audience, because you, Rebecca, was of course a huge part of this project. I'm going to start with just mentioning that there was, to sort of set the scene in terms of pediatric pain and making a real difference here. Rebecca, along with Chris Eccleston and a huge number of really influential people, published an impressive commission on pediatric pain. It was a huge report, like we talked about in our session just before this seminar. We talked about how commissions are getting bigger and bigger, and there are 20,000 words, and who has time for it? But these days, we understand that we need infographics, and what this commission did was to summarize the key points of action in an infographic. The recommendations came down to making pain matter, making pain understood, making pain visible, and making pain better. And the recommendations were presented at the European Academy of Pediatric Society. So that's an important way that you launch a new piece of transformative work. You launch it at a big society, and Chris Eccleston, of course, also did a recording, a video where he really promoted how pain is a common feature of daily life. There's been a lack of progress over the past 40 years, and you need to and he was reinforcing these key messages from making pain matter to making pain better. So overall, this commission raised awareness, it provided evidence-based recommendations, it inspired further research, and it advocated for policy change. And it's amazing how these recommendations have been adopted by healthcare organizations and governments around the world. But what was really special about this piece of work was that it was followed up by going back to some research. So what Rebecca Slater did with her colleagues was to then continue with this piece of research that looked at the effect of parental touch on relieving acute procedural pain in neonates, and how that would affect not just reducing pain, but also parental anxiety. And it followed on, of course, having delivered this commission and having raised the profile of pediatric pain. But then it was also followed on by a linked comment where a peer in the field talked about the importance not just of this research, but actually publishing a piece of research that didn't necessarily bring positive answers. In fact, we in the field would talk about the PEDAL trial, or these results as being negative, in that there was no difference to relieving acute procedural pain in neonates by this intervention. But the learnings that came from doing this kind of research in this particular environment, in the NICU, was extremely powerful. And where this campaigning really continues beautifully is in the collaboration with Bliss. Bliss being a charity in the UK for babies born premature or sick. And what's incredible is the journey from this commission through research, through linked commentary, and through the campaigning and the work with campaigning. Bliss now presents information on their website and is helping parents and healthcare professionals teach them how to care for their neonates and to alleviate their newborn children of pain, which I think is absolutely beautiful. And my third example has to do with sickle cell disease, a neglected disease, but it's incredible because this global burden of disease study really set the scene by saying that more than 500,000 people were born in 2021 with sickle cell disease, most of them in sub-Saharan Africa, and it's the 11th leading cause of death in children aged less than 5 years. And without intervention, more than 50% will not live up to 5 years of age. These are incredible statistics. So yeah, 2021, the sickle cell disease collaborators got together, pulled this data together out of the global burden of disease, and they presented this study. They then followed up with a Lancet Hematology Commission that set some defining global strategies to improve outcomes in sickle cell disease. And just like the Pain Commission, we had this incredible infographic that really gathers complicated recommendations, but it makes them visibly appealing, it makes them very accessible, and it breaks down barriers to communication way beyond our academic and medical silos. And we know this made a big difference because within a year, the African health ministers were gathering to launch a new drive to curb sickle cell disease. The WHO Regional Director for Africa said we can no longer ignore the significant burden caused by sickle cell disease, referencing both the Lancet Hematology Commission and the GBD work. And the beautiful ending to this story, which is far from an ending, it's only the beginning really, was the creation of the World Coalition for Sickle Cell Disease. Again, 5 focus areas for policymakers, speaking directly to politicians about the need for scaling newborn and infant screening, integrating sickle cell disease management into primary care services, expanding overall access. All of these recommendations leading directly from one piece to the other, reinforcing this idea that we need equity and we need to break down barriers to care. So what's the key to success? Of course, we've got credibility, convening power, coordinated communication. This isn't just something that happens overnight, of course. This has taken years and years. Just some figures to give you an idea of why perhaps we are able to communicate and to reach so many people, is that we have more than 36 million annual visits to our website and more than 108 million downloads from thelancet.com. eTalks have more than 3.9 million subscribers. We are on X, formerly Twitter. We're on Facebook. We're on all the social media outlets. But also, our press team has an incredible network of journalists associated with the Associated Press, BBC, CNN, Financial Times, The Washington Post. Our Lancet podcasts are listened to by thousands of listeners each month, and our webinars are watched by lots of people. So we have an incredible network, and this is definitely helping us spreading the message. But there are definitely challenges, and that's what I'd like to just focus the rest of my talk on. So we have a manifesto for better lives at the Lancet Group, and our strength really builds on values and integrity. Our manifesto says, we apply the highest standards for medical science, we increase the social impact of that science, and we get to better lives. And the components are really advocating for practice-changing research. We're editorially independent and important. We create context, we inform leaders, we start debates, we set agendas. These are all really important things. But the reality is that we're operating in a world that relies on integrity, person integrity, editorial integrity, review integrity, content integrity, and reference integrity. So these are not things to take for granted at all. And the reason we should care is that we're actually seeing a lot of publishing and organized crime. Within the Lancet, we know that article retractions, in fact, this is not just the Lancet, this is in all of publishing. Article retractions are increasing due to research fraud and misconduct. Publishing ethics cases are becoming super complex, requiring specialist investigative skills and capacity. And there are complex networks of bad actors driving systematic manipulation of the editorial process. Paper mills are a really important example of this. And this timeline here just shows you how in 2015, when you might remember the first papers being retracted from pretty famous journals, Tumor Biology owned by Springer, some journals being delisted. Hindawi, you will know, as a predator journal. But the problem has become more and more severe, and as late as 2024, more than 30 editors were found to be involved in fraudulent activity. The paper mills and the editors are sharing profits, and fake editors are appearing on special issues. And this matters because it is sort of shaking the foundation of the quality of our research. I think another important element is the role of AI in the integrity of the scientific record. If you ask scientists what the negative impacts and what the positive impacts are, I think it's fair to say it's fairly balanced. But at the Lancet Group, we are actually very worried about what the role of generative AI is. And this generative AI, I mean language models that are able to generate reliable sounding language on any topic in science and medicine. And this has the potential to drastically influence scientific publishing at the Lancet Group. So we are definitely worried about AI. It is listening, it is reading, it is watching what we put up, and it is being used, and we need to make sure it is being used appropriately. So new advances in science and medicine build upon a priori research. This is how we in the scientific community think and how we operate. But for this cycle to continue, it is critical that we build upon validated and trustworthy work. And I think it is all of our responsibility. It is our responsibility as editors, your responsibility as authors and reviewers, but also our readers and publishers and institutes, funding bodies and governments' responsibility to make sure that this works. We work a lot with ICMJE, so this is the International Committee for the Medical Journal of Editors, to understand how generative AI should be used and declared. We are working with COPE, who helps us with ethics challenges, and we work with STM Integrity Hub to really understand how to protect the integrity of science. There is no doubt in our minds that it is technology, experts, and collaboration that is needed to safeguard the integrity of science and meet the challenges in research integrity of today and tomorrow. Another problem which I think will be very relevant to you will be the problem of reviewer burnout. It is something we care a lot about because the quality of our content is only as good as the quality of the authorship, the written piece, but also the peer review that it has undergone. The problem we're seeing is that with an increasing volume of publications, reviewers are getting increasing reviewer invitations. And by providing outstanding reviews, you're getting more invitations. And so the delay while review is taking place is getting bigger and bigger, and the frustration as an editor and an author is being felt. And of course, the burnout is really being felt by you as reviewers. We think the solutions are in creating a more diverse review pool by providing training in peer review for early career researchers. We always encourage our peer reviewers to involve their more junior staff in helping with the peer review. But also we need to be thinking about the possibility of cash incentives and being more strict on peer review. We know that it is a billion-dollar business. This interesting piece here found that the total time reviewers globally worked on peer review was over 100 million hours in a year. That's equivalent to over 15,000 years. And in the UK alone, we spend more than $400 million US on what's really unpaid from the publisher's point of view, peer review. So that's really problematic. So we should perhaps be thinking about alternative peer review models. And I have to say, at the Lancet Group, we're far from ready to make that change. But other people, other publishers are thinking about the role of automated peer review that use screening tools to play a more valuable role in supporting and assessing the compliance and some of the more some of the elements relating to quality, such as compliance with guidelines. why does this all matter? Why do you need to care about research integrity? I think you need to care because we're seeing a lot of information disorder. It's the paper mills, it's the reproducibility crisis, it's the influence of AI, and it's peer review, burnout, and cost. And the reason that's problematic is that it is fueling mistrust in science. If we cannot trust the science that we are publishing, that is going to fuel political polarization. It's going to give space for conspiracy theories. It's going to fuel science illiteracy, going to foster health inequity, and that is a huge threat to public health. So we must deal with the problems underlying this information disorder to avoid and to counteract the mistrust in science. So for 2025 and beyond, as we prepare our first issue of 2025, and of course the next 11 issues of the year and beyond, how do we continue maintaining the best science for children and adolescents? We're going to remember that we're doing it because we're advocating and we're collaborating for childhood equality, equity, and a right to health. We want to do it because children and young people deserve attention in their own rights. And we're going to do it by communicating the best science through the strongest campaigns. And we're going to do it with urgency, integrity, respect, expertise, and technology. And we know that trust takes years to build. We've spent enough years building this trust, and we also know that it takes seconds to break. So we rely on our International Advisory Board, and we rely on our youth advisors, such as these wonderful young people, to help make sure that we continue to publish trustworthy and reliable data. And so on behalf of the whole editorial team at the Lancet Child and Adolescent Health, I want to thank you for listening, and I hope this has been informative to you.
Do you want to come and sit down?
Yes.
Thanks, Josie. I mean, that was really excellent and a fantastic tour through all of those papers. Actually, the Lancet Child and Adolescent, sorry, the ECD one was presented by Linda Richter to the health ministers at the G20 the following week.
Correct, yes.
I think that was the beginning when WHO ratified the nurture care framework.
Exactly.
So,
yeah, super important context that I just didn't have enough time. There are all of these, I could have chosen just one case story and really emphasized the many elements. I hope that it gave you the impression that it's just putting another paper out there is just not enough. It's about using multimedia. It's about taking a seat at the table. It's about presenting to policy makers like Linda did, and like commissioners have done, in the Pain Commission, and then with the sickle cell disease was another really powerful example, where you have actors where the crisis is worst, and you get those involved in the policy making decisions.
So perhaps I know I've asked you a lot of questions already. I sort of feel a bit, just perhaps, we did talk about it earlier, but perhaps say something especially for the earlier career researchers about, a few words of advice about not being shy and, what you do about getting yourself across the threshold in terms of getting published, because many people feel, well, the Lancet is just outside outside anything we could think about.
Yeah, when we spoke about that earlier, it started with, well, how do you really get your foot? How do you get heard? How do you get seen? And we do get hundreds of submissions every week, and we have to make really quick decisions. So for those of you who are early in your careers, I think that not being shy means not hesitating to send us your content, not hesitating to come and say hello to us, not hesitating to invite us to give you talks and to share some advice about submitting a paper, about writing the cover letter even. And it's about joining your more senior advisors, telling you that they want to be part of peer review, so that next time you get invited to do peer review and you have to figure out how on earth am I going to fit that into my extremely busy schedule, well, maybe, just maybe, a little bit of the pressure can be taken off if you can share it with somebody who would benefit from having being part of it. And an important thing to note is that when you are joining peer review, in that peer review report, your name will be shared with editors of the journal. So we will see your contribution, and that's important for you to know, so that your name will be recognized when you submit a paper to us or when you meet us at a conference. So that's really important.
Thank you. Other questions? Yeah. Okay.
Thank you so much Thank you so much for your presentation and the success stories, which definitely answered my question. My question is following up on Alan about the peer review. What would make a good review? Because in some cases we sometimes don't receive like guidance, and like what do you look for when you ask someone to review a paper, and what would make it helpful for the editor and for the Lancet team?
So it will depend on the paper. If it's a research paper, we will always secure 3 clinical reviews, and of those clinical reviews, we want different perspectives to be covered. For a much larger project like a commission, which you've been involved in, reviewers are doing something extraordinary, because they're being asked to look at the arguments. Of course, they're looking at the perspective that is given and the evidence that is given, but they also have to really challenge whether there is a space and a need for this now. I think commissions, the way we want commissions to be, they have to do something extraordinary. And I think after a year of preparing that commission, it can be, I think sometimes authors lose track of what the real challenge is. And so reviewers are there to remind them. So what we look what we ask reviewers to do is to dare to challenge the research and the recommendations. I think we don't want reviews to just say, we agree or we don't agree. We want them to say why. And we also hope that reviewers can help strengthen work. If it's not strong enough, what would make it strong? What would make it robust enough? And if it's not for the Lancet Child and Adolescent Health, why isn't it for the Lancet Child and Adolescent Health? And if this isn't the research group we should be looking for, then where should we as editors be looking for this kind of work, if this is what we're interested in? So I don't feel like I'm just a mediator in a relationship between authors and reviewers. I very much feel like I am taking this opportunity to engage with an expert in the field and to learn from that expert. So I'm not just going to pass on the message. That is really I'm going to listen, I'm going to understand what the problem is, and I'm going to try to see how we can fill that gap with something else. So that's really important, I feel, for you to understand next time you do peer review, is that we're not just passing on the message. We really read your comments and we're learning from it. And I also mentioned in the session earlier that whenever a paper sort of survives peer review, has done well, has been well received by peer reviews, we bring it to a Lancet group-wide meeting. So, and in that meeting, we have to present the paper, we present the peer reviews, and all the editors have to, add a note about, some editors are very brief about it, and other editors are much more thorough. But the idea is that we all need to agree that this belongs in a Lancet title. And so when you're writing your review, you can trust that this is not just the audience for your review report will be huge. It will be really valued. It will be, it will be shared. So it's really worth investing that time we think it's a really good investment of your time.
So I was thinking about the advancement of technology that we know that has a positive impact, but also sometimes can have a negative impact on adolescents and child, especially mental health.
Yeah.
So I want to ask you if you, in Lancet, find challenging to have the velocity of the advancement of technology and how to balance that pace with having spreading property information. You know, like I want to ask you, I don't know if I formulate well the question, but what I want to know is how you balance the pressure of the pace of technology with the publications. Because sometimes, for example, with public policies, it lasts 3 years to finally implement a public policy about I don't know, a social media, and then the social media changed completely. I want to know how this in the academia and in these papers can impact.
I think it's very difficult. I think we are always feeling like we're 5 steps behind, and but I imagine that others look to us and think that we're 5 steps ahead, and maybe it's just the confidence with which we operate that gives that impression. I think in terms of keeping up with technology, we have realized that we need to diversify, and editors cannot do everything. Editors, to be good at reading manuscripts and understanding who to go to for peer review and how to edit a manuscript, of course, to the science communication, that's an expertise. But we need people who are on top of the technology. We need people who understand how to make infographics and understand how to use social media. And I think we're at a point now where I feel like we're barely keeping up. But like I said in the session earlier also, I feel like we still have a very old-fashioned way of communicating our science. We have our PDFs, but they are really no more than a digital version of what we used to publish in print. And I think we need to really be thinking about a much more advanced form of communicating science using technology. And I'm not sure that technology exists today, but I think we need to think about how to use websites and very interactive websites to communicate our science and to help our researchers communicate science. That's the kind of technology I wish we could keep up with, because I know we were talking about a climate countdown earlier, and we were talking about the COP website and how wonderfully interactive that is. It's something we're so far behind on, making our website really interactive. It is difficult to navigate, and I think you have to be familiar with the Lancet web platform to use it. And I think that's how we end up having our favorite journals. It's that we become familiar and we invest time in a particular platform, and we become comfortable finding information with that platform. But I think where we can use technology to make new visitors to our platform feel like they're able to access data really quickly and get information really quickly, I think that would be a huge advance. So I hope that's okay.
Go, Mariam.
Thank you so much for a great presentation. My question is related to health issues that are often stigmatized. So mental health, for example, or vaccines being trusted in like some communities, etc. Yeah. And I wanted to know, with your experience with Lancet, what impact do you think that the media and scientific communication have on reducing the stigma on such health issues that are important and that need to be addressed?
So it's such an interesting topic, because you might well know that the Lancet really, well, it doesn't have the best track record in terms of vaccine safety and in promoting vaccine acceptance. publishing information from, and having that authority, that stamp of authority when about the link between the MMR vaccine and autism. I mean, we're still dealing with that mistake and the repercussions of that. So, so when it came up again, well, of course, it's a live issue all the time, and we think a lot about how we learned some tough lessons, and we continue to learn those lessons during the pandemic about how to communicate it. I think our lesson was that we as editors should not be censoring information. I think that became very clear that we were, when the media, when experts realized that we were, challenged us on the sorts of research we were choosing to publish and not choosing to publish. I think that sends a signal, and I think that degrades trust. And the moment you can't trust that editors are making an unbiased decision about what to publish, that's difficult. So I think we have to be really careful as editors to decide what the best way of communicating around vaccine safety is. But at the same time as making sure that we've given everyone a voice, we're also very clear on not publishing damaging content. So your question was about how to, well, could you repeat the second part of your question? Because that was really interesting as well. Was it locally, like? Yeah.
Talking to a mental health expert will have more effect on reducing depression or anxiety in like someone who's suffering from it. And the same thing with vaccines. Generally, we know that some vaccines at least have been tested, they are effective, but in some parts of the world, there's just like this belief that no, this is something to eradicate this population or something like that. And there's also proof that shows that it's not the case. So how media communications, especially for medical journals, could address this to remove the stigma around those two topics.
Right. Now I understand why I got a bit lost. It's because it's actually a really complex question, right? I think what we're trying to do, I'll mention two things. I think what's really important is to make sure that in addition to publishing research, that we supplement and complement that research with opinion pieces by more untraditional authors from more diverse environments where the stigma is seen. So people who are dealing with this, people with lived experience, people who work in traditional healing, people from communities that are not taken care of properly. It's about letting the Lancet be a platform for people with all of this lived experience, and by showing that, by giving them a platform in the Lancet and us having our contacts, that's how we can shine the light on these issues. So I think it's about giving space in our pages, and it's about alerting, with your help, alerting our communications officers about the importance, about where this needs to be sent, and that letting them use their communication methods to disseminate it in the right way.
Bolu, and then Polly.
Thanks for a very insightful talk. My name is Bolu. I'm a DPhil student in psychiatry. And I was very intrigued by especially the part about the global burden of sickle cell disease. Yeah. And it just got me thinking, how exactly particularly for early career researchers, do you get that diverse group of individuals, particularly populations that are traditionally marginalized? How do you get people to be more involved in public health research and in advocacy, and just improve the diversity of editorial content, as the case may be?
So we spend a lot of our time networking and interacting and looking for people whose voice we have not heard from, but who are clearly impacting the health and the lives of children, but who haven't used a platform like the Lancet before. And it's about giving them an opportunity and showing them how their work could be presented in written form. And I think it's about finding a way to make space in their work lives to write content, which they might not think is a priority, but we can convince them that there is an opportunity here to spread and to advocate and to disseminate the idea that will benefit not just them, but other communities like them in other parts of the world. So I think that that's really important. Yeah.
Polly.
My name's Polly Hardy. I'm the director of the NPU Clinical Trials Unit here at Oxford. And my question very briefly to you, and then I'll expand a little bit, is how do you choose? So when you're developing your themes, your themed commissioned, how do you choose and who do you involve in that choice? Because they're so influential. It's so fantastic, the examples that you gave and how influential they can actually be, and how it leads to next steps and how it reaches policymakers. But obviously there's a lot that's left out. And so I'm just really interested to know, who do you get together around the table and say, okay, what's the next big subject? How are we going to decide what the next big subject is, and who's going to help us, and are they the right people?
So very often, first of all, we have very little influence in who is in the final authorship or commissioner group. We typically are only involved in inviting the initial, we call them gurus, a very, very small core group of commissioners who will take on this project and will assemble a group of experts from all the various fields and subspecialties that they think are important. These things take years, so it's not something that I think when we have the initial conversation, I think it's fair to say that we won't know the final makeup and the final set of recommendations until further down the line. So we have very little input on who's going to be there and who's not going to be there, apart from the very initial core group. But also it's important to say that these commissions often start out as smaller projects, and then they build up and build up and build up. I think an example like the Pain Commission was extraordinary because we hit it really big. It was a topic that no Lancet title had seen much solid research in, and the Lancet Child and Adolescent Health went big on this topic. And then really good research followed on. And I think it was really important for that commission to pave that way and to really open up the space. But for many others, like the early childhood development, this was preceded by decades of work, starting with child survival in the late 90s, in 2000s, then building up through all angles of child health and child well-being, and then finding ways of finding the gaps. And I think learning from the gaps from previous series and previous projects, I think we've been really good as a Lancet group to recognize how we can fill gaps and daring to repeat messages, because we realize that the priorities are really, there's so many priorities, but if you really want something to stay at the top, you have to keep bringing it back up. So it's about learning from previous mistakes, finding gaps from previous series, previous projects, finding a core group, and then giving them the space and resources and the editorial support. But apart from that, we don't have much involvement.
That's really helpful. Just to follow on very cheekily, is there a PPI or involvement? Do you involve the patients and the public in that decision of how to choose themes?
So this is something that we're very late about. You know, we talk about lived experience and the importance of it, but formally, it is something that commissioners are encouraged, sorry, so that's not very formal, is it? We encourage commissioners to implement PPI, but it is not an editorial requirement. It's not policy. But also here there are some differences between journals. The Lancet Child and Adolescent Health, we work with youth advisors, and we expect our commission and the big projects to have had youth involvement, youth engagement. But that's it's not something we have a lot of oversight with. So we could perhaps learn a lot more from that.
We've got 3 more questions. You want to go for it? Yeah.
Thank you very much. Yes, excellent presentation. My name is Mark Lodge. I'm a member of the, just for transparency, I'm a member of the Lancet Oncology Cancer in the Commonwealth Commission, which is, as you say, grown like Topsy, huge. I have 2 quick questions. Firstly, it seemed that some of the questions to you earlier were like, as an individual, how can I get, you know, the attention of the Lancet? And I'm wondering whether there's also advice that can be given. Well, find someone senior you know who's already working on something that you are really interested in, and go and offer yourself, offers whether as a runner or whatever, because you'll end up, this is the quid pro quo, with your name on the paper.
Yeah.
All right? So you don't actually have to fret and, you know, about approaching the editor, although editors are very approachable and they can be approached, especially at conferences, especially if you bring them a cup of coffee at the same time. They're really pussycats. But, so that's the first thing. Just think about, don't just think about yourself and I'm all alone here. There are lots of people in the community who are doing stuff. Hook onto that carriage and you'll take you far. Now, the question I really wanted to ask was, you mentioned because I think a lot of people here want to make a difference.
Yeah.
That's the bottom line. We like writing, but we want to make a difference. You mentioned the 1,000-day, first 1,000 days thing, how it came out and it was successful, how we measure success. It ends up being a government policy paper. The media is not responsible for implementation, all right? But it is responsible for parenthood. So, and I think the Lancet's quite good at this, going back 5 years later, saying, well, we published this 10 or 5 years ago, and now we're looking at actually what's happened. And frankly, guys, it isn't very good. And so off you go with your second crack at something that you didn't solve. You got a little way, but you didn't solve. How expensive is that in terms of editorial time and planning to actually, right, we're going to go back to something we did 5 years ago and have another go at it?
Gosh, you know, I think we're extremely fortunate as editors within the Lancet Group that that it is part of our, it's the reason we're there. Advocacy is just as important as the research. So I cannot recall ever hearing Richard Horton, David Collinridge, who you know very well, you know, these are people who are leading on our editorial priorities, and you know how we dedicate our resources. Not once have I heard anyone say that this is probably, when it comes to child health, when it comes to oncology, another big one, but it's never a waste of resources, and never too much trouble to just go through it again and to fill that gap again. We also have the support, of course, of incredibly passionate people who are willing to do most of the work. The editorial work is peanuts compared to what you do as authors and what the peer reviewers are going to do. So we of course need to think of the whole ecosystem and all the resources that are going to go into doing this. But I think that the case studies tell us that it is always a good investment, and it is always, it's a new generation of readers, it is a new generation of politicians. The turnaround of politicians alone makes it worth repeating series after series, because it's like they've never heard it before, that it matters, that what we do with children in the first 1,000 days. Because they're there to survive their tenure and nothing else. So I think for those of us who have been in the field for decades, we might think that we have a difficult decision to make about, do we run another series, another commission? But I think given the incredibly dynamic environment we operate in, that makes it worth repeating. I think repetition is super important. So I wouldn't worry at all about editorial resources.
We've got two, we just need to end in a minute or two, but two quick, one online, and then Heather, you'll have the last word. So from Tanya Manchanda asks, thank you for your talk. Given that reviewer quality can vary, is there any sort of training you know about which can help ECRs learn how to become better reviewers? If not, do you think training to become a better reviewer is necessary / helpful?
I think that's a wonderful question, and it's so heartwarming to hear that someone young, early in their career stage, cares about providing a good quality review. And perhaps having heard me say that it is not just something we pass on to the authors, but it's something we as editors benefit from, a group of editors, that's why it's important. I don't know where there are formal resources to learn how to do peer review. I suspect, I think from personal experience, it is something you do, you practice and you learn, you do it by trial and error. You tell your supervisors that you want to be involved in this, just like you tell your supervisors that you want to be involved in their written projects. You have to be mentored to do it. But actually editors, and this is not a formal thing, but editors will work with early career researchers to sort of in a shadowing capacity. So we can work with people to show them the process. Any one of you can join us for one of our manuscript meetings that I've talked about a couple of times. These are the manuscript meetings where we bring manuscripts that have survived peer review. So we have the full set of peer reviews. We've got a manuscript, and all of the Lancet editors are there to discuss this paper. And you can join in on this manuscript meeting, and you can hear how we talk about it. And you can hear what elements of a peer review we emphasize, we really pull out for discussion. And you can see a variety of peer review reports too. I actually think that's a really important thing. It is to ask your colleagues, ask your mentors to see peer review reports that you have written and submitted to editors in the past. And I think seeing those examples and being part of the process, working with editors, asking editors if they can shadow, I think that would be a good starting point.
Great, thank you. And Heather, I think you've got the last word.
Thank you so much. This has been so inspiring. I was really reflecting on kind of everything that you've been saying about the importance of really good communication in science. And as someone who's just starting out in my career, I'm thinking about the skills that I need as a early career researcher going forward, both in terms of presentation, like so verbal communication, but also written communication, and how I guess the impact of my work will be contingent on that. And therefore I'd be really interested to hear your thoughts and advice in that vein.
So yeah, I think you're right that it's verbal and it's written. But I think you also have to remember that you're not writing and speaking alone. You're writing and speaking with a group of people. And I think being in a dynamic environment where you're pinging ideas and you're speaking with people is really important. Let me just give you an example of podcasts. This is a really, really powerful, I can't remember the numbers, but we have like 85,000 listens a month. And like at the Lancet Child and Adolescent Health, we'll just do one a month. That's plenty because we don't really have the resources. We'll pull out a paper that we think has made a really big impression on us. Either it's the way it went through peer review that made an impression, or it's the messaging itself. And we just get on we have a call, we record it, we do a little bit of sound editing, and it's a podcast. But that conversation really highlights some elements of the research and why you do it. And it's by doing that kind of, having conversations like that, I think that's your middle ground between the formal presentations and the writing, and getting really good at sharing your research and telling your story to a variety of audiences, I think is just going to really oil the mechanics of writing, and writing with impact, and understanding very quickly your audience and what to emphasize for your audience. So I would really recommend that you take opportunities to write opinion pieces, to do podcasts, to just get onto small snippets of multimedia where you can just practice that elevator pitch of your research. I think that will really make the bigger, more formal projects seem a lot less daunting, and you'll just build some expertise and some tools in communicating that will be really powerful. So that's good.
Thanks, Josie. That's been really fantastic. We could have really gone on for a lot longer, but I think we've probably had our fair share. And thanks so much. It was an absolutely fascinating presentation. And I think we will take the liberty. You said we should take liberties, inviting you back again soon.
Thank you.
Give us an update. And I think, things like, by the way, this is recorded, so it'll be on the Blavatnik YouTube channel in a day or so you can listen back. And I know lots of pictures of slides, you people taking with the cameras, they'll all be there. So, and thanks so much for a wonderful talk.
Thank you.